As we navigate sickness season, when it comes to RSV, there are ways to protect yourself, and that includes for pregnant women and newborn babies. Let's discuss with Dr. Nicola Mercer, the Medical Officer of Health in Wellington, Dufferin, Guelph. Hi, Dr. Mercer. Thanks for your time.
Oh, my pleasure.
Can you start by explaining the difference between someone who is pregnant receiving the vaccine versus newborn babies getting the antibody injection?
Yeah, this is a really important topic because RSV, or respiratory syncytial virus, is really common, especially at this time of year. And what we do know is that babies, if they get this virus, especially early on, if they're only a few months old, they have a really high rate of becoming very ill and often ending up in hospital. So we know that almost all children are going to be exposed to this virus in their first 2 years of life, but it's really important for those who are infants, like meaning under 6 months of age, over their first season, which is this fall and winter. So what we know is that we can protect anybody with antibodies that your body produces, or antibodies that we give you. So there is a vaccine that has to be given to a mom between a very specific time frame, so between 32 weeks and 36 weeks gestation. And the mother produces antibodies, which then go through the placenta to the baby. Or when the baby is born, we can give antibodies directly to the baby. So those are the two differences. So they're both considered an antibody product. The one is via the mother and the other is directly to the baby. And currently, the product that's recommended the most is the one that is given directly to the baby.
Okay, what are some of the major concerns if newborn babies do contract RSV?
Yeah, it's a respiratory virus, so it's very similar. You can think of it like flu or COVID. So if you have a child, especially a young infant under 6 months of age, they have no immune system to defend against this, and their lungs or trachea, all of their little tubes that are in their lungs are very, very tiny. And so when they get a disease like RSV, they can become extremely sick with a pneumonia. It often sounds like croup. For those of you who know what croup sounds like, the children can be quite distressed, require oxygen or at least moisturized air, and are often hospitalized.
Kind of talking about the flip side of things as well, for anyone who is going through pregnancy, what happens if you get RSV during that time period?
Yeah, and another really interesting question. So what I do know, there are some limited studies that have looked at this, and what they found that for pregnant women who get RSV, they don't seem to get any more of a severe course than they would normally. So, and it's probably to do with the fact that the RSV virus is so common. We've all had it probably many times in our life, been exposed since children. So we have some protection, but the baby, when it's born, has no protection. So what we're trying to do with these new products, a new one that's available for the baby, is to protect the baby in the first season, their first RSV season. So that would be if your baby was born after April of 2025, this is their first RSV season, so the one that's coming up. So it's to protect that baby from getting really ill. By the time they get a little bit bigger and their lungs mature, if they get RSV when they're older, then they have their body has the tools and the size of which to respond better.
So for anyone who will be becoming a new parent soon in the next few months, what should they be keeping top of mind when it comes to RSV and their baby?
This is a really important question. Yeah, the first thing is you have to know about this as a virus. If you are pregnant right now and you're expecting in the near future, the things that you have to think about is COVID, flu, and RSV, because not only can they make you sick, but you don't want to give your newborn baby who has none of those protections any of these viruses. So what you need to do is, everybody in your home, please roll up your shirt sleeve and get a vaccine to protect the baby. As a mom, you should talk with your healthcare provider to say, is the product the right one for me, that I should be getting it as a pregnant woman, or should my baby get it when the baby is delivered? Right now, if you deliver a baby in hospitals here in Ontario, you'll be offered the vaccine. Well, it's not a vaccine. You will be offered the antibody product for your baby to protect them. And I encourage everyone who's listening to please allow your child to be vaccinated with this antibody product. It protects them this first year, because it is so common, and we really do see an awful lot of babies every year who get admitted to hospital with RSV.
Okay, finally, just want to talk about the local landscape. Are we seeing any current cases at this time?
Actually, we are, and we've started to see that that RSV is starting to increase, which is exactly what we would expect. We usually do see it start anywhere October, November, and it will continue right through, usually until about April. That's our typical RSV season, and especially with Christmas coming up and with the holidays, lots of people are going to be visiting your baby. If you have a newborn, may be exposed to lots of different people, so protect them from all the viruses that you can, and we are seeing it in our community.
Okay, well, it's great advice for women who are pregnant and anyone expecting to become new parents in the near future. Dr. Mercer, thank you so much for this. Dr. Nicola Mercer is the Medical Officer of Health in Wellington, Dufferin, Guelph. Thanks again.
And thank you.